Welcome. Hello, listeners and viewers. Welcome to this MHT Conversation. So, today joining us, we have clinical psychologist Dr. Noufal Hameed. Thank you for joining us, Doctor.
Thank you so much for the invitation, and I hope we have a good interactive time together. Thank you so much.
Yes, of course. So, Dr. Hameed is a clinical psychologist with a PhD in clinical psychology from the National Institute of Mental Health and Neuroscience, and he has extensive experience working with youth. Am I right? Yeah.
Oh yes, I hope so. At
So,
least.
so to begin this conversation, I would like to give you guys a fun fact. Did you know that 50% of our population, the Indian population, is below the age of 25, while 65% is below the age of 35? So just imagine the huge percentage of the worldwide number of youth that India alone makes up. So that being said, today we're going to be discussing youth and mental health. So to begin this discussion, Doctor, can you enlighten us on some of the common issues faced by our youth today?
Okay, so as you very rightly pointed out, all over the world, there are several countries that is experiencing what we call as a youth bulge. That the total proportion of young people to its total population is huge, and especially in India. So as you very rightly said, that's a huge number. So it's the size is big. Though we say that it is raw material. So if you count young people as 50% or 40%, it is mostly potential than actually something that can be used. So that is opportunities that we need to utilize, so that we need to convert this energy into productive force. Otherwise, the energy will be used and it may be misused or abused, or maybe used in bad way. So as you rightly said, it is important, and very very important that if we look into the status of mental health of young people in the country, there is a lot of doubts whether are we actually going to make use of this huge number. I mean, we have an advantage in number, but I think if you take many number of issues that our young people experience, it is it has to do with the mental health, it has to do with education, it has to do with the cultural issues, religious, political. So there are so many different levels of issues that our young people experience. Among all these, if I can count all as very important, maybe among all the important, I think the most important would be the status of mental health among young people, because it is such a mess that our young people's mental health is in. And it's not me saying, it is the findings from countrywide studies show. So I think the most important issue that we need to understand and address as soon as possible is the challenges that young people face in their mental health and related aspects of life.
Okay, so talking more about this, why don't we discuss some common disorders that are prevalent amongst our youth, and maybe more importantly, signs of those that we often overlook?
Okay. So just like for example, if you look into the existing, for example, when a person comes to us, we if required, we diagnose that person as having a psychiatric mental illness. Okay, so there are different names, and if you count, there are two different kinds of systems that is worldwide use. I think maybe you're aware of ICD and DSM. So if you take the number of mental illnesses that is given in these books, it may be about 200 or something, around 200 different names of illnesses we can count. But like any other illnesses that we can say, some of these illnesses are very common, some are not very common. So if you take the whole number of the whole gamut of mental illnesses that is there out there in the young people, anxiety disorders and depression would be the most prevalent and most widely spread, and something that causes the maximum level of disability among young people worldwide, not just India, worldwide also. So I would say that based on the existing literature, that anxiety disorders and depression is the most what is a frequent mental health conditions that is affecting our young people.
Mhm. So normally, I mean, a lot of young people, at least on social media, tend to overuse these words like, I feel so depressed today, or, I have an exam coming up, I'm so anxious. And we tend to misunderstand the real meaning of the scientific disorder. So I think it can, prevent us from actually reaching out when we are at a severe state. So how can we identify um, the actual disorder when we are most at need for, professional help?
Okay. I think it is one of the very key question that anybody who wants to deal with the mental health issues understand that how do we identify if somebody is experiencing some kind of mental health condition. And oddly enough or funnily enough, or maybe if you can find the opposite of funny, that every, so as I said, there are about 200 180 200 different mental illnesses, and you take the symptoms of any of these mental illnesses, all these symptoms, if you take individually, is something that we engage in on a daily basis. Okay, for
Mm,
example, smiling is a symptom of mental illness, laughing is so, is crying is, getting angry, get doubtful, becoming afraid, becoming happy, so you take anything that you experience in a daily life, it is a symptom, it can be a symptom of mental health or mental illness, mental illness or mental disorder. So what we usually do is, there are different ways of diagnosing mental illness. Okay, there are certain criteria. For example, if you want to say that a person is experiencing depression, you need to have a particular set of criteria to be met. So but as a generation, as a society, as a community, we may not have to look into the scientific definition of how to diagnose a person, because our idea is not to diagnose a person. As you said, I
mhm,
think the idea is that we try to we find out the person, we identify the person, and we help him, or we find him, or we get him
mhm,
help. So to do that, what we need to look into is, probably to learn about what he actually means by mental illness, and maybe the common signs of mental illnesses. Even then, for example, if somebody asks me what is mental illness, so usually I would tell that, mental illness is not a symptom. Okay, there is no single symptom which will be called as a mental disorder. Okay, so mental
mhm,
illness is a group of symptoms. So there are many symptoms that is occurring in a particular person, and not that every person will have the same symptoms for the same disorder. I mean, you might come across two people with a depression, but they may not have same kind
mhm,
of same kind of symptoms in among them. So mental illness is a set of symptoms that appear more or less together, and it is causing significant disturbance to the person. Okay, significant disturbance. So these symptoms that is in the person is causing significant disturbance. And where do we find this disturbance? We find this disturbance either in the personal life, so the person's personal life is
mhm,
impaired, there's significant difficulties, or in social life, a person has difficult social life, or in academic life if it is a student, or work life, or job life if it is an adult who is working. So
okay,
the maybe the easiest or crudest way of identifying, sorry, somebody who might have a mental health condition is, you look at somebody, okay, and you find that person that he has been doing well, he has been doing good, but oddly enough, later, sometime back he has been behaving differently, or you see him to be
mhm,
not the older kind of person. So if you, what you need to do is whether this person is affected in his personal, social, or occupational life. Okay,
mhm,
and see whether it is because of any identifiable physical health condition. For example, your neighbor is not going to work for 1 week, and you go to you go to visit him or her, and you realize that he's broken leg, he has broken his leg, and maybe he's taking rest. So that is not probably mental illness. But if you find this person and he's sitting in the room and saying that I don't feel like going for work, I'm just tired, and so in the absence of an identifiable severe physical health condition, if somebody's health is compromised, if somebody is not doing good in his life, then probably it can be a mental health condition. And there are so many common signs of mental health condition. So it is usually expressed in either three ways. Either it affects our cognition, the way we think. So you might
mhm,
find a person whose thinking is disturbed, or you might feel a person feeling where the emotions are affected, or the behavior. So if you find a person whose thinking, way of feeling, or way of behaving is not helping the person to grow, to become better, or to maintain a healthy relationship with the society, probably that he or she might be having some kind of mental health issues. And our job is not to diagnose a person with mental illness. The easiest way is, if you find somebody not well, go to that person, greet that person, and probably sit with that person and ask him, how have you been feeling, or how are you, good morning, how are you, and I notice that you have been not doing well. Is there anything that I can do for you? Is there anything that is going on with you? And trust me, that person is not going to tell you what is going on, but we have to offer. So we have to keep that door open, and people will usually come to us. And signs and symptoms, I think, check any what we say standard online platform, and I think it is going to be there in list, and it keeps changing. So our job is to identify somebody is in distress or not. The rest, if it is significant, it should be left to a professional, because we don't want to deal with things that we are not capable of doing. So we have to take a call on
Okay.
that.
So, supposing we have a situation like uh, a group of friends in college, and supposing I notice a friend of mine, and she's been showing these signs of, maybe being very low, not feeling like participating, and she's sometimes she can be very irritable. So I think that, okay, our relationship is getting strained. I want to be there for her, and I feel like she needs to get professional help. How would I go about approaching this situation?
Okay. So I think this is something we need to do with what we say, with care, and with so much care, that because if you, I think you will be very aware that talking about mental health and suggesting somebody that you need a professional help can be very, very stigmatizing in our society. I mean, for example, I might realize that I'm having a mental illness, and even then, if somebody comes and tells me, Noufal, you need to go to a psychiatrist or a psychologist, I might feel offended. And that is not to do with the person, it is the way society has been created, how society has created that image of mental illness, something as a taboo, something as something very, very bad. Okay, so we need to keep that in mind, that no matter how good our intentions are, asking is helping is not just in the intention, it is a way we show that helping mentality. Okay, if you remember, uh, we know that there are so many of our friends, and often they are trying to help us only. But it does not feel that way. I mean, how many times we go to a friend without pain, suffering, and we share it, and we leave that person with more pain than we started with. And not that the other person is not our friend. He or she is our best friend. And their intention is the purest and the best. But ultimately, we don't feel helped. We feel actually worse. Okay, so it is not just the intent; it is the method of doing it. So how we show that I support you, as you asked, you find a friend of yours and you care for her, you want to support her. So it is about how you show that support. So the usual ways or safe openings, that I would call it as, maybe you can go to that person, and you can greet that person, hello, good morning, or good afternoon, whatever is the appropriate, and say, how have you been, how have you been. So usually people would say that, I'm fine. I mean, that is a staple answer that we all have,
Yeah.
right? It's a plastered answer, how are you, and I'm
Mm.
fine. And we have to have that patience to go beyond that first question of how are you, because how are you often gives you an automatic reply of I'm fine, and often we take that answer and we move away. Okay, so we do not have to do that. So when we hear I'm fine, then we have to think, is it actually that person is actually fine? And as you said, you already know that person is not actually fine, but often we keep comes back thinking that, oh, this person do not want to share. Okay, so we need to ask, oh, but I just wanted to share with you that I have been noticing you, and you have been behaving differently. I have seen you being different from usual self, and I just wanted to tell you that, this is what I would say. I just wanted to tell you that, if you wanted to do something, if there is something that is going on with you that is troubling you, I would really love to listen to you. And don't even offer support like what I in the beginning. I mean, maybe the person do not want support that way. So you can offer
Mm.
that, the offer to help. You get the idea, that you may not have to tell that I'm going to help you. We can say that I'm ready to help you. Okay, so that the person would say, and trust me, that person often would say that, no, it's everything is fine, it's nothing. So usually we again, so some people will stick with the second question, but the second answer comes that I'm fine, it's all right, then we leave. No, we need to think, actually, is it actually everything is fine? Okay, so the usual answer, I often say that it's nothing. Often people say it's nothing. Okay, but it is not nothing. So what usually people would mean when they say it is nothing is that it is nothing, it is not full stop, it is nothing. Then inside the mind they would say that I think you would understand, that I think you won't like, that I think that you would want to help me with. So that part they say inside their mind. Okay, so And I often keep saying, what was the last time when you said it's nothing and it was actually nothing? I think the time is that it is never. There is always
Yeah.
something. Most often there is something. So we need to go beyond that level of nothingness and look into the eyes, reach out to the heart and offer your availability, not even help, offer your availability. And that person would say no, still say that, no, I don't have any issue. Then you say, oh, all right, I wish that, and I believe that you're going good, that's all right. But if you feel like there is something that you wanted to share, I'm available, do let me know. Then you move back. Okay, do not force help on somebody else. Okay, then if you see the second time also, you can see I have, as I told you before, I'm available, if there is something, do let me know. Maybe the third time this person is like, oh, this girl, this person is actually genuinely interested in art. Why? Because people with the mental health condition, I often compare it with somebody walking through bushes with what we call thorns. Okay, thorny bushes, like
Mm.
you walk through it, you come out on the other side, your body is fully scratched, with so much scratches on your body, and everywhere it pains. So even if you want to touch that person to support, that is going to hurt. Okay, so mental health condition is something like that. They're hurting all over their body, not just mine. So even if you want to hug that person with the love, it is still going to hurt. So we need to be very, very careful. So show that care, show that concern. Trust me, anybody will tell that whatever is going through. And I will just add one more thing very quickly, that often people ask me as a psychologist, how is it that people share their darkest, deepest secret to you? And I have experienced people sharing, pouring over their hearts, in the very first session. Okay, just they have met a stranger, complete stranger, they sit in front of me, they share their heart out. And people often ask, how do they do that? How do you do that? I tell them that people don't share not because they don't want to share. They don't want to share because they're afraid. Okay, they're afraid that the other person make fun of me, they're afraid that the other person might think bad of me, they're afraid that if I tell my issue, they will be telling it to other people and they might make fun of me. So understand that fear, take away that fear. Trust me, there is, I won't think there is a person in this world who do not want to share his or her pain, and who would want to
Mm.
keep carrying pain inside one's own heart. So our job is to
True.
understand that pain and remove that pain and let people talk. And we need to be patient. Even though we have good intentions, it is not easy for people to talk. I may be in significant
Mm.
distress, still I don't want to share, because we know how sharing can go bad. And we all know, we have all been on the experiencing, the receiving end as well as the giving end of more pain, right? By sharing.
True.
So yes, you offer it, you keep your distance, you take care of that person. Trust me, he or she will be sharing his or her concern with you without a fail. Yeah.
Mm. Yeah. I just have to say that I love that analogy of the thorns and the pain, because I feel it's so right that when you're going through something like that, it's so difficult to lean on somebody else. You just feel like, or they're like, you, the minute, even if you're talking to someone and they look away from you, you suddenly feel like, oh, am I making a mistake by
Yeah.
sharing with them? It's definitely very difficult. um but I feel like maybe we are getting a bit better in terms of talking about mental health nowadays with our
Mhm.
generation, the younger generation. But there's still that, as you said, there's still that stigma related to mental health. If someone comes up to you and suggests, you would feel very offended. So how do we spread the message that it's okay and it is important? How do we start changing that mindset?
Okay, okay. So, if I don't know if there is any illness on all over the world as long a history, past history as mental illness, and as long history of carrying the pain of taboo and stigma also. Because since the time immemorial, as long as mental illness was there, there has been a taboo associated with it, a stigma associated with it. And even I don't know whether you're aware of the word stigma. Stigma is used to refer to a stamp, that was put on the shoulders of the slaves. Okay, so it's a
Mm.
permanent stamp. Okay, so you stamp that person, so that will remain on the shoulder or on the hand till the person is alive. Okay, so that is where stigma comes from. Okay, so mental health stigma is similar. A person is mentally ill, and he is a different person for his whole lifetime. So and this stigma is so much. So I usually tell people that I tell people that when they ask me what were you doing last 5 years, I was doing my PhD, and I would say I'm doing my PhD in National Institute of Mental Health. Okay, so I start saying the name of the institute, and I very obviously the moment I mentioned the word mental, people's brains stop working there. They do not listen or hear the remaining part. So people get stuck on the word mental. Okay, so that word is such a what we say heavy word. I say that that word is a single word that carries the pain, suffering, and misery of thousands and thousands of people for many years. Okay, uh, the amount of pain people have gone through just to avoid that word, that you're mental. That even now, how many millions of people just don't seek help because of that word. I tell that that is not a single word. That is that's what to say. That's a single entity which is maybe like a black hole. Like you cannot weigh the actual weight of that entity. So though I tell people, everybody is mental. Mental is actually an adjective to the word mind, something that is related to mind. But we use that term in an entirely negative way. Okay. So to answer your question, it's very related but a different thing. To answer your question, stigma or anything like that, is you can equate it with the darkness. Okay, stigma is darkness. Okay, so to beat darkness, there is only one force. It's light, right? I mean, you cannot make noise and beat darkness. Okay, you cannot throw some powders or you cannot give some medicine. Nothing. To beat darkness, the only force that is available on earth is light. Stigma is darkness, and light is education, awareness. The most important way is to educate people that mental illness is a reality. It is an illness that people suffer. It has nothing to do with curse or sin or bad habit or weakness or personal lack of will. So the most important aspect, if you're somebody who want to work to reduce the stigma, the best and the most important strategy to do is to educate people. Tell people that that this is mental illness is real, that it is an illness, that is not a choice. I mean, I often ask people, if you think mental illness is a choice, would you want to select it? No, if you don't want to select it, why do you think that others are selecting their choices? So often people say that it's his choice. So you have to ask, but would you have selected it? Then, no, I won't accept it, I won't select it. Then what makes you think that the other person is accepting it as a choice? So we need to educate people, keep them informed about it, and over a period of time there will be a shift. Okay, so one person changed is one person changed in the society. So 10% changed. So it is a gradual work. And as you very rightly said, more and more people are talking about mental health and illness. There is positive and negative about it, but I think at least in if you take the number, the quantity, more people are definitely talking about mental health. And last 5 years, 6 years, I have been continuously engaged in this single aspect of reducing stigma. So I keep conducting so many training programs on how to reduce stigma of mental health and illnesses. So awareness programs is the most important aspect of that. And from the very beginning, so educating the masses about mental health and about the importance of it, as well as mental illness and what it actually means, I think stigma will go away, gradually. It's actually reducing more and more. I remember, because when I started studying psychology, I used to be like somebody strange, somebody old, somebody with some kind of issue. Now people, I say I'm a clinical psychologist. I say I'm a clinical psychologist, and we're a clinical psychologist. So that change has come. So yeah, we expect more to do, and programs like this and people like you can do a lot to make this change. And yeah, it's one step at a time. So one step,
Yeah,
1,000 person takes one
true.
step. It's 1,000 steps in a day. So it has to be mass action. Yeah.
Yeah, that's very right. It's great that you have such an optimistic view. I hope that more people can adopt this, because really that's the only way we can look towards change,
Yeah.
is if we look to that utopia where we, can accept mental health. So, talking about educating people, what I feel is that, so there are a lot of these programs to talk to youth, and the youth and our generation are generally, they tend to read up a lot about these things like mental health, and awareness is being built gradually, but definitely. But I think that seeing that the people that we innately look up to, the people that we spend a lot of our time with, these adults in our life, parents, teachers, it's very important to, get them on board with this movement. So how do we start educating these adults of how to create that, supportive and loving environment?
Yeah, again, a very pertinent, very important question with respect to mental health and mental illness, because most young people nowadays, at least I can see the number, increasing people with mental illness or mental health conditions, young people who want to take help, and either their parents do not support it or agree it, or their parents itself is to a partly, maybe a partly factor that is contributing. I do not say the word causing. One person
Mhm.
cannot cause mental illness for another person, but contributing to the worsening of the condition. And also, uh, so we say that treating mental illness is changing the what we say, the entire family. You cannot treat an individual person. You can treat, but in mental health, in mental illness, it is change. So for a person to recover from a mental illness, just focusing only on the person may not do the complete work. Okay, the person's context has to change, and the immediate context often is the family. So it is very important that I remember once I had a client, and he was admitted for 1 month depression, and he was treated with the pharmacotherapy, then psychotherapy, and he was doing well. And about 3 months later or something, he was angry. And even now I feel that that anger was justifiable, that anybody, even if he didn't have a history of depression behind in the past, would have got angry at that moment. Like an anger that could have happened to anybody. But the single statement that came from his mother was that तू तो पागल है यही करेगा, that you are mad, this is what you will do. A single sentence, he was back to depression. Okay, I would not say that it caused depression, but every change that we made over 3 months was undone in a single statement. So not that the mother wanted it. Okay, I mean, I really remember that mother. Even though she's very caring, very concerned, doing everything for her son, except that that time she did something that undid all the work. Okay, so it is very important that we educate. So in case of mental health, again, we need to educate the parents about. For example, if you take any person with mental illness, one aspect of the treatment, one key aspect, integral aspect of the treatment would be that we educate the parents or the significant others about what condition it is and what needs to be done and the changes that is required. So we call it psychoeducation. So without psychoeducation, no treatment, no therapy is complete, because you cannot expect a person to change on his own completely and go back to a society and integrate to the society on his own. That is not possible. For example, I use another example of addiction. Okay, imagine that a person is addicted to drugs. So that person comes to us, we see him, the addiction goes on, and he gets completely recovered. He wants to go back. But think of a situation that he's going back to the same society, right, from where he came. No change has happened. And if in a place where 10 people used to drink when he came to the hospital, now maybe 15 people are drinking. So probably he's going back to a situation where it is worse. And we cannot expect him to do all the work on his own. Yeah? So we need to include these elements and include educating the family, training the family, and sometimes we have to adopt a family therapy, because the pathology, the difficulty is not with the person. Maybe it is a young person who came. Then we realize that the biggest issue is with the parents. Okay, so after taking the history, understand the history, then we include the important ones in that. So that is individual level. So there are times when we need to educate them, there are times when we need to train them, there are times when we need to do therapy for themselves, for the parents itself. And maybe on a larger level, today's youth is tomorrow's parents. So educate them now. When they become parents, they will become good parents.
Mm.
So we don't have to wait for them to become parents so that we can train them now. Or even not even young, maybe from school time. Think of it. We learn everything. We learn how to launch a rocket, but not how to talk to a person standing just opposite to you. So
Yeah.
what I mean, of course it's important to learn to launch a rocket, that's true, but we need to focus on the other aspects also. So we are I think despite calling us the smartest of the creatures on earth, I mean, we ourselves claim that that's true. Still, we do many things not very very wisely. We teach our young people everything, but not about mental health, not about how to control your emotion, not about how to talk to another person, not about how to treat another person with respect and dignity. So if we don't teach them that, what are we doing? So what happens is that we are somewhere trying to fit life into everything that we do, right? I mean, we work, we study, we have friends. So we are trying to fit life into all those things. We forget that everything is a part of life. It's the other way around. You know, life is the biggest thing, and we need to fit everything into it. We forget that we think that, I will get a good job, then I will start doing good. I'll become good. No, that's not going to happen. You need to find life. You need to find everything within and as a part of life, not everything as life. So if we focus on that, educate the young, educate the children, and include more of mental health related aspects in their curriculum, make it a continuous process. Trust me, they will become very good parents of tomorrow. And for example, if I become a parent, I'm sure I will use some of the learnings that I have had from the field of psychology. No, a psychologist cannot be a parent. Like, not that I will be a psychologist parent. A parent has parenting is a different thing, but still,
Yeah.
yeah, I will use some of it. So I know that certain things we did as our parents did is be maybe with a good intention, but maybe not with the good outcome. So yes,
Mhm.
we need to educate the public, we need to educate the young so that they become good parents. And who are already parents, we have to educate them or train them or do therapy for them. So it requires on the intensity of the difficulty that is experienced, depending on the intensity. Yeah.
So, okay, so rightly said, we need to start building this importance of mental health into building it into our society. So it just makes
Yeah.
me think that, obviously in India, we're not all at equal states of, how do I say, income. So we've got the middle class people and upper class people who probably have a lot more information about mental health and a lot more resources. I mean, you've got better schools with better guidance counselors, or the parents have the resources to send their kids or their teenagers for, therapy sessions. But what about the poorer families? As it is, somebody who's making like a humble income is going to prioritize, okay, I need to feed my family, I need to maybe send them to school, but it kind of ends there. Why would they spend that money or their resources on mental health? Because as it is, it's not built into our a major part of society. So to people who can't afford it, how can we give it to them? How can we make it more affordable and more available to not just youth from middle class families, but to everybody?
Okay. Okay. So good that you asked that question, because this year's mental health mental health day, the theme was greater investment in mental health. Greater
Mhm.
access. Creating more access. See, despite the fact that mental health is a fundamental aspect of life. Okay, so you may have the perfect body, perfect physical health, and if you lack mental health, you are you cannot do anything. You know and
Mhm.
but we do not remember that. I have had a client who is an athlete, 6 feet 6 inch tall, at the prime of his physical prowess, physical ability. And when he comes and sits in front of me, his complaint is that, sir, I find it impossible to wake up in the morning. Okay. And you look at him, he's his muscles are bulging, like it's flexing even when he moves. So prime of his physical health, but he cannot wake up in the morning because he's depressed. Okay. So even if you have complete physical health, in the absence of mental health, nothing is going to happen. So a good body, good physique without mental health is like a good vehicle without petrol. No matter how good the engine is, if the if the oil is missing, if the petrol is missing, the vehicle is not going to move. So and I don't know whether you have seen this. There is this guy called Nick. I don't know his complete name pronounced. Nick. He does not have four the limbs. Four limbs. He's
Yes.
born with that congenital anomaly. So he lives such a fulfilling life than many of us who have all the limbs at our disposal,
Mhm.
right? So even if you're limited physically, still mental health is possible. And actually mental health is more important in a sense that you can still find peace and happiness and joy, even if you're even if you're physically ill. The vice versa is not possible. You might have the perfect body, but you may not be enjoying the life. So to
Mhm.
make it accessible, it is more of a societal cultural concern, policy level concern than an individual work. Okay. For
Mhm.
example, to make mental health facilities, therapies available, accessible to all, we need more policy level changes to that. Okay. For example, government has to come up with more and more programs and policies. For example, there is district mental health programs, national mental health mission, so they go more to community, and nowadays the availability of a psychiatrist and psychologist is more in the communities than it used to be earlier. So there has to come a change from the higher level, from the policy level, but that happen, there should be an increasing public demand, right? I mean, a government will not go with the policy unless and until there is a increased demand from the society. So on one side, we need to focus on making public aware of the need of mental health and the importance of mental health, and make people ask about it. And on the other level, people on the higher levels of authority, they need to start implementing it. So it's a both two-way street, and we do not have to wait. Often I see people that, okay, this same thing, even if I wanted to do something for mental health, there are so many millions of people who cannot afford mental health, services. So I'm not going to make a mistake, going to make any difference. So they get discouraged. So I tell people, yes, it requires a change from the societal level, the policy level, the national, country level, but we can wait for that. But while we wait, we focus on that single person whom you can make change in, right? So one person change is one world changed, right? I mean, one person is one world. So focus on that part, and also demand for the other. So it's a what we say, collaborative building of individual level demand as well as the policy level changes. And when more people keep asking for a specific thing from the government, I'm sure government is going to spend more money on that. But trust me, people are not demanding mental health. They demand everything, not mental health. And if you don't get what you do, even if you don't get what you demand, and think of something that you don't even demand. Government has their own ways of not just a particular government. They have to work within a lot of limitations, and mental health is not demanded, and it is not going to get provided also. So we need to make it a point that it is available to more people. So create grassroots level demand, make people ask for it, and trust me, that will be provided gradually. But these are gradual process.
Yeah, definitely. A drop in the ocean, right? Small changes make
Yes,
the
and
ocean.
if you so every ocean is created with the drops only. You take away each and each one drops, and the ocean will cease to exist, no matter how big the ocean is.
Exactly. Yeah. That's very, very eloquently put. I feel like I'm not a psychology student, but the way you explain everything with examples, it makes it very clear the way the situation is and what we need to do. So as we wrap up this session, I just want to ask you, is there anything that you would like to say to our viewers, something that could help them out, especially the youth watching this?
Okay. So I do not know whether I'm, what is capable enough or deserving enough to advise or give a suggestion to people. But as a young fellow, when I was young, what I thought was that, I could not make a change. I'm a student. I don't have money. I cannot make a change. So if there is a single learning, single suggestion, single idea that I want to share with young people is that do not be afraid. Do not be afraid that your actions are not going to change the world. Even if you change a single person in all your life, that matters. I keep telling in all my sessions that one is a very big count when you're counting life. Okay, maybe when you're counting money, maybe one is not a very big number, but one life changed, influenced is a very big number. So what I would want to suggest to people is that do not be afraid. Focus on what you can do, and focus on what aspect that you can bring change, and keep doing that, and trust me, the bigger change will follow. And try to find peace, and make your mental health a priority. Make it a priority. It is not one of the priorities, it is the priority. Everything else is fitting into mental health. So make your mental health priority, learn about it, understand about it, and trust me, we will create a world. And I'm not thinking about a utopian world where everything goes fine, and everything is not going to be fine, and it is not required also. I mean, if it is not required, why are we even thinking of that? We don't need to have everything fine in our life to have a good life. We can have a good life even with what we already have, if we remembered what we have. So focus on what we have, think of what we don't have, find a balance. Make your mental health a priority, and do not be afraid. Do not feel hesitant. Do not feel discouraged that your actions are not going to change. Your actions is the change, and it will be the change. I'll conclude with one statement, one quote from our own Mahatma Gandhi. Says, you can shake the world gently. You can shake the world gently. So each of our actions will shake the world gently, and so do is our actions for mental health. I think that is what the only thing I would want to share.
Thank you so much, Dr. Hameed. This was an amazing conversation. I'm sure that all of our viewers have enjoyed it. And so thank you for joining us. And I hope to see you guys next week. Okay.
Thank you so
That's
much.
it.
Yeah.
Thank you, Doctor.